Welcome to Cambridge Health Alliance Health is Wealth. My name is Roberta Robinson. I'm Director of Marketing and Outreach for the Geriatric Division of the Cambridge Health Alliance. And today we have a special guest, Luann Bruno-Murtha. And you are?
I'm the Division Chief of Infectious Diseases at Cambridge Health Alliance.
And today we are going to talk about a subject that's not very often talked about, which is one of the reasons we're doing this show. And we're talking about sex in the elderly with a focus on infectious diseases. Is that correct?
That's correct.
Okay. So let's start perhaps by saying that there are some myths to this, and people sometimes think that just because we get old that we are not sexually active anymore, and that itself is a myth. Isn't that correct?
Indeed, that is very much a myth. In fact, research has shown that the elderly are quite sexually active. And we could review some of that information as we go on.
Yes.
And unfortunately, there's other myths that with aging, that people lose their desire for intimacy and they're not interested in sex. And there's nothing further than the truth.
Wow. So this is why, because especially in the elder generation, like I would say 80s and 90s maybe, or maybe even 70s, late 70s, that it's not a subject that we talk about very often, and especially with our provider of all people.
Yes, unfortunately that is the case, and research has shown that only 8% of men and 22% of women have actually had a conversation about their sexual health with their primary care provider, and we need to change that.
We need to change that, and I guess it all starts with you. If you have any problems that you're having, or if you have any concerns or questions, then perhaps you need to bring it up to your primary care provider.
Very much, I would recommend that. And we know based on research that has been done, and this is actually published in the New England Journal of Medicine, that older adults between the ages of 57 and 64, evidence shows that 3/4 of that population are sexually active. And in a age group from 75 through 80, age group 65 through 74, about 50% are sexually active.
50%.
And in the oldest cohort that was studied, that is the 75 to 85-year-old age group, 25%, or a quarter of those individuals actually reported being sexually active.
So we need to arm ourselves, and we need to protect ourselves, because if we do not protect ourselves, who is going to? Right?
And that's a very important message that we want to communicate to our audience, is that currently 40% of adults living with HIV or AIDS are now greater than 50 years of age. So it is imperative.
What's the percentage?
40%.
40% of older adults
are living with HIV and AIDS now. And it is imperative, because of that everyone who is sexually active with a new partner, or perhaps a risky sexual encounter, it is imperative that they take precautions so they do not acquire HIV or other sexually transmitted infections.
So how do we prevent this?
So the best thing you can do is to utilize condoms, and that is something that a lot of older people don't consider because they're not worried about pregnancy or conception, but it is the best way to protect yourself against sexually transmitted infections.
So we need to, now, I know that at the parenting centers, they readily provide and pass out condoms for the younger population. Does that happen anywhere for the elders?
That's a great question. I do not know where free condoms are available for the elders, although I could recommend some websites that might provide that information. Okay. There's some wonderful websites. One is Safer Sex for Elders, and it's they use the digit 4 And that's a wonderful website. Also, AARP, the American Association for
We all know
Retired
that
People,
one.
They also have resources available. Another recommendation would be the Administration for Aging. They have information about HIV, AIDS, and tools for elderly adults to really educate themselves.
Because as we're talking and as I'm thinking, I know there are a lot of older folks, older adults as they call us now. It's much more forgiving. That that are on a very limited budget, and some of them are making choices between foods and medications and things of that nature. So I would imagine the expense of the condoms might not fit into their budget.
And it's important that the condoms be latex condoms. Latex condoms, okay? That they are what's required to prevent transmission of infectious agents. And also important that you do not utilize petroleum-based lubricants with latex condoms because it will weaken the condoms. So it's important to use water-based lubricants, and I highly recommend lubrication to avoid micro tears in the vaginal wall, because that happens with routine sexual encounters, even in young people, but in older people, because they have less natural lubrication because of physiologic changes, you're more prone to localized trauma, which is actually more suitable for the transmission of HIV and other sexually transmitted infections.
Really?
Yeah. So it's very important to use latex condoms with ample water-based lubricants.
Do you happen to know any water-based lubricants out
KY
there?
jelly, for example.
KY is water-based.
Yes.
So we see that advertised, and it's in the papers and the magazines and even on TV. So KY is a water lubricant, and remember the latex. Now, what if someone has allergy to latex?
So there are some other condoms that would provide protection. Polyurethane condoms would then be the next recommended type of condom to utilize.
Okay, and that would
protect them against sexually transmitted infections.
Right, because let's talk about the sexually transmitted infections. HIV is one.
Yes.
Probably maybe the best known. Others?
Other infections include chlamydia, and actually data provided by the Massachusetts Department of Public Health shows that our chlamydia rates in the state of Massachusetts over the past decade have increased fourfold. And that increase is in adults 50 years of age and greater.
So can you tell us what chlamydia is? Because
Chlamydia,
they may not all know that.
Chlamydia is a bacterial infection that causes inflammation of the cervix and could also cause inflammation of the urethra, the opening where your urine exits from. And it may be asymptomatic in females. Not all females will necessarily experience symptoms. And if it goes untreated, it can cause pelvic infections.
Really?
Gonorrhea is another example. Gonorrhea rates in Massachusetts among adults 50 years of age and older have also gone up over the past decade, threefold.
Really?
And syphilis, infectious syphilis rates have also gone up in the state of Massachusetts in 50 years of age and older, more than eightfold.
Wow. So this is why we do this show, to educate. So it's obviously happening, and we definitely need to protect ourselves.
Absolutely. And another point I want to make is that I was able to get data for the communities that we serve, Cambridge, Somerville, and the M. area. And we are
Which is the Malden, Medford, Chelsea, Revere area.
We are seeing increasing case numbers in our own community. So this is not a function of just inner city rates going up. It is a function of our community rates are going up as well.
It sounds like it's a function of the population. And is it within a certain age bracket? Is it the 50 to 64? Or?
So data that I was able to obtain from the state looks at 50 and plus and categories as one group. But if you look at the CDC data, they actually break it down into 55 through 64 and then 65 and above. And their data actually shows that the proportion of infection in the older group has gone up more significantly than the younger group. So the rates are increasing in the older adults even. And so it really necessitates that everyone take precautions.
Right. So it really is necessary. I know that because, we may be beyond the age of pregnancy and conception, that we feel that it might not be an issue, but that's not, obviously, not so.
And sadly, AARP survey done in 2009 demonstrated that only 12% of men, older men, reliably used condoms with their sexual encounters, and 50% indicated that they never or only rarely used condoms. And we have to change that.
Now, in the older adults, I think it's something that they weren't necessarily used to doing, right? Because right.
Yeah, of course, and when they were younger, they were using condoms for birth control, not to protect themselves against sexually transmitted infections.
Exactly.
So there are great educational tools if you want to familiarize yourself with the proper use of condoms. And some of those websites that I alluded to earlier, and perhaps we could provide again at the end of the program, can be utilized. And there's YouTube videos that you could utilize as well.
Everything, I'm telling you, everything is on YouTube.
And it's important as a female who is interested in being sexually active, that you insist with your partner that they practice safe sex. And as a female, you need to speak up and protect yourself.
Now, for some of you mentioned the chlamydia, and some women may be asymptomatic.
Yes.
With that. If they have symptoms, do you know what some of those symptoms might be?
It could be a discharge. They could develop some urinary symptoms like burning when they urinate.
Similar to
it can be similar to a urinary tract infection in some circumstances. So I would suggest to anyone who's sexually active with a new partner that they share that with their provider, so that their provider can assess their risk and may opt to screen them for sexually transmitted infections. And
is that a blood test?
It would not. It would be a urine test.
A urine test.
And it's recommended now that everyone have an HIV test. It's no longer a disease of just young people.
Right.
In fact, 17% of all new HIV diagnoses are occurring in folks that are 50 years of age and older. 17%.
Oh, 17%.
So HIV is not a disease of young people. It does not
or of a certain population either. It now is running rampant throughout.
So it's
with our elder population. These are supposed to be our golden years. When we get in, we want to be able to enjoy the time. We definitely don't want to subject ourselves to any infections.
And protection is available, and everyone should be encouraged to practice safe sex, regardless of your age. Age does not prevent you from getting these diseases. And although you may not become pregnant, you certainly don't want to get these infections. Many of the bacterial infections, like chlamydia, syphilis, are readily treatable, but we're actually now encountering drug-resistant gonorrhea. So gonorrhea is becoming more challenging to treat. So you want to do everything you can to prevent even what previously had been readily treatable with antibiotics.
Is it a different strain, maybe? Or?
It's just antibiotic-resistant strains have really come from other parts of the world and affected U.S. citizens.
I see. Wow. Well, this is why we do the show, because we learn so many things on this show, really. So I know it's a sensitive subject, but we need to be able to speak freely about it. We definitely want to make sure that we protect ourselves, and we need to talk to our providers as well. And, you know, they may be a little hesitant to speak to you about it because it is a sensitive subject.
It is. And I would recommend that you bring this subject up with your healthcare provider. Let them know if you are sexually active. Let them know if you have a new partner. Certainly if you've had a prior history of sexually transmitted infections. And a thorough history would include the doctor asking you, what are your behaviors? What type of behaviors do you practice? That's important in terms of risk assessment. And then deciding what they're going to screen and how they're going to screen you. So I would recommend that you be open with them, and that if they don't initiate the conversation, you initiate the conversation. And it could be sensitive, it could be difficult, but perhaps one recommendation I can give you is that you just tell the doctor that, you know, I've been reading in the newspaper that rates of sexually transmitted infections are increasing, and I'm concerned because I've been sexually active with a new partner, and that may be all you're going to need to open up some good dialogue with your provider.
Right. So definitely, we need to protect ourselves, and hiding things and keeping things quiet and pretending that it doesn't exist definitely is not the way to do it. We, for however many years we have left, we do not want to be plagued by any infectious diseases.
No, and I certainly don't want to discourage older adults from being sexually active, because we know that it's an important part of psychosocial well-being.
Right.
And it's certainly no reason why you shouldn't be sexually active.
Right.
And
Just protect.
Just practice safe sex.
So are there any other myths that we know about sex in the elderly, that you?
Well, certainly, older adults are much more sexually active than people
Than we think. Right.
And that's a good thing. And just want to emphasize that practicing safe sex is critically important because of infections like HIV, where we don't have a cure. And we know that when older people get infected with HIV, they don't do nearly as well with the treatments because of the drug interactions with other medications they may be taking.
Oh, so that's an interesting point. Because a lot of older adults have conditions and they may be taking one or more medications.
Correct.
And then the treatments might not be as effective, or might even be counterproductive.
Often the treatments don't work as well in older adults as they do in younger adults. And we know that people progress much more rapidly when they're older with HIV. So the primary message here is prevention.
I guess that is definitely the message of today's program. Now, just for a second, I know this is not your area of expertise, but I know that I have read that even folks with dementia or Alzheimer's might have an increased sexual urges and needs for that. And I know there are different schools of thought out here on that. But if you have a consenting adult, you have a consenting adult, I guess. And if one is being comforted and enjoying the feeling of intimacy that goes along with it, then I guess what could be the harm, we might say, except that this piece here, this piece of prevention and using. Now, is condom the only way to really protect ourselves
against sexually transmitted infections?
That's it.
Yes.
So there is no pill, there is no ointment or anything that we could use, but we must use the condom.
Certainly with new partners, with risky behaviors, if you're in a relationship with someone who you trust and you could speak to, you may both opt to go and get screened together, so that if everything tests out negative, you could feel free of proceeding in the future without protection. But that, is going to take time to build that trust with.
Is that a blood
significant
test for HIV?
Blood test, yes, for HIV. It's a
Blood test for HIV. So these tests are relatively painless. It's not anything that you are going. It's not really invasive. Blood tests we get all the time, and it's just something else that gets run.
And you can actually get anonymously tested for HIV, and those sites are available in almost every community. A good resource for that would be the Administration for Aging, to find out where you can get an anonymous HIV test, if anyone's interested.
Okay. But putting our heads in the sand definitely is not the way to go. And pretending it will never happen to me. We always think it will never happen to me. But the fact of the matter is, it happens to people.
Oldest adult that was diagnosed with HIV was 88 years old.
88 years old.
And the belief was she was infected by her husband, who had been injecting drugs. So,
Her husband of who so many years?
Yes. So, the important point is when you get involved with a new partner, you don't really know everything about that person. You don't know 10, 15 years ago what that partner was doing, even though they may come across to you as pristine. You don't know. So, it's important to have open conversations with your partner, and ideally to come to some consensus about safe sex, and if you can come to some agreement to get tested together to make sure that you don't have any sexually transmitted diseases that you can transmit to each other.
Now, in the case of that couple that you just cited, had this gentleman been a drug user for years? Did she know he was injecting?
That wasn't clear whether she was knowledgeable about his practice. I think it was not, I don't think she was.
She wasn't.
But that wasn't clear. It was a case report I read. And not all the details were clearly
disclosed. Right. So I guess we never do know.
Better safe than sorry. Yeah.
Absolutely. So what else can we talk about? There are lots of resources out here, and you've cited some of the websites that people can go to anonymously find out some information. But truly, the show that I do and the presentations that I do, all about empowering you folks and everyone, empowering ourselves to take charge of our own health care. Because if we do not do it, then who will? And I know that the older adults have kind of lived life by default. And they waited for something to break, and then when it broke, they went to the doctor and they got it fixed. But today it's a whole different thing. Today we want to empower you to take charge of your own health care so that maybe it doesn't break.
And certainly with diseases like HIV, there's no cure. We could manage it. We've come a long way with management. But
in other words, people may live longer.
That's right.
Having the disease, right?
Right. Other sexually transmitted infections we can readily treat under most circumstances. But again, I think prevention is key.
It's an interesting point with the medications that people are on, though. That's a very interesting point, that treatments might not be as effective.
There are a lot of drug interactions with the HIV medications.
With the HIV.
Mm-hmm. So if you're on other medications for other diseases, it does complicate your treatment.
It makes it much less effective, which has a disease run rampant. Wow. What are some of the other pieces of information we need to tell our folks? Is there anything else that we're overlooking or not mentioning that would be important for them to know?
Well, I think it's critically important that they have a conversation about it with their primary care provider, and not just about sexually transmitted diseases, but if they're having any kinds of problems with sexual health issues, because studies have also shown that sexual health problems are fairly common in the elderly, and many are readily treatable. Issues related to lack of lubrication, which is part of physiologic aging,
Right.
that is readily treatable. And as we know, men who have erectile dysfunction, which is fairly common, that also is readily treatable. We don't actually know, although some people surmise, that the use of the little blue pill,
Viagra.
the medications for erectile dysfunction, may actually be fueling STD increases in the older population.
Oh, that's an interesting thought.
We don't really know whether that's the fact, because we know that the older population is increasing anyway. So there's not really good studies to show whether the little blue pill has actually contributed to sexually transmitted infections. So we can't really blame that.
Right.
But I think it's important, if men have erectile dysfunction and they seek treatment, that they practice safe sex, and that they don't, be irresponsible when they get their problem treated.
Right. Thinking that all cares are behind us when we're in our 60s, 70s, 80s, 88. That's getting up there. We definitely would not associate that age commonly with sexual activity. So it's a surprise. It's a surprise to me, and it should be a surprise to all of us. But maybe when they write a prescription for the little blue pill, they need to write a prescription for the condoms as well, so that they are distributed together.
I think it should be part of the education about the medication, about protecting yourself.
Right.
And, just to make a point about the frequency of sex, in that study that was published in 2007 in the New England Journal of Medicine, just looking at the oldest cohort, the 75 through 85-year-old adults, of that 25% that was sexually active in that population, half of them indicated that they had sex at least twice per month. And there was about a quarter who had sex at least once or more per week. So there are some older adults who are very sexually active.
Right.
So, the myth that older folks are not sexually active is
A big
truly
one.
a myth.
It sounds like it's a very big myth, so we definitely need to protect ourselves. Well, we want to thank you. We hope that you've been enlightened a little bit with this show. I certainly have been enlightened, and thank you so much, Luann, for coming on board and speaking about this very sensitive subject for our viewers. It's all about being proactive and taking care of ourselves, honestly. So thank you very much. And thank you very much.
Thank you for having me.